A devastating loss. Over 10,000 Canadians have died from COVID-19. Before we go on, here are just some of their loved ones. Look at this.
My mom, Estelle Sermon, died in her long-term care home of COVID. I just wanted to hug her, and we couldn't.
He was my everything. Anybody can catch this disease.
I'm not going to just let her be reduced to that right there, a statistic.
You cannot ask for a better son or a better little brother.
This virus is deadly, and it took a giant from our lives.
People, real people, not numbers, real people, over 10,000 Canadians. 10,000 loved ones, 10,000 family members, 10,000 friends. Where do we go from this grim milestone in the middle of a second wave? Is it getting better, getting worse? The press gallery is here. Joyce Napier is the Ottawa bureau chief for CTV National News. Robert Benzie, Toronto Star's Queen's Park bureau chief. And our special guest for the press gallery today is Dr. Abdu Sharkawy, CTV News infectious disease specialist. Good to see all of you. Doc, I got to start with you. This is a horrific milestone. I know you see it all the time. Are we getting mixed messages? The Prime Minister said we may have to change our Christmas plans. The Premier of Ontario said the numbers are moving in the right direction. Are we getting mixed messaging as people are starting to push back against the rules?
Well, you can look at it as mixed messaging, or you can look at it as trying to fight a battle of hope and reality. And the problem is hope gets you somewhere, but reality is what you have to contend with on an everyday basis. I think we have to be very realistic about what we're up against. We have to be realistic of the resources we have. And I don't think we can sell false hope without making sure that we've got credible evidence to support it. And I'm not sure we have that right now.
Benz, let me go to you. I'm intrigued what happened in Ontario. We're talking about more restrictions, and the Premier said, wait, things are going to get a lot better. And this is a moment of one of the most tragic milestones in Canadian history. What do you make of what we're hearing from some, Premier you cover closely, like Doug Ford?
Yeah, Evan, we were surprised by the Premier's comments today, and it's in advance of some new modeling that's going to be unveiled by Dr. Adelstein Brown of the University of Toronto's Dalai Lama School, who has been working with the government very closely. And Mr. Ford told us that he's encouraged by what he's seeing. It's not that we've turned the corner or bent the curve, but he certainly thinks that we're maybe trending in a better direction. Now, remember, just last weekend, we set a record for daily infections in Ontario of more than 1,000. That's the first time we've ever reached that mark. This virus has killed 3,100 Ontarians, so almost a third of all of Canada's deaths. Now, obviously, we're nowhere near what Quebec's rate is. More people have died in the city of Montreal than in the whole province of Ontario. And Ontario's population is about 9 times that of the city of Montreal. So I think there's some context there. But the doctor is right. Like, we have to be very careful about selling false hope, because this is still, I don't want to say it's raging out of control, because I don't think it is, but I think it is still a threat, and it's a threat to our health system and to our economy. I think we have to be very careful about selling hope.
Yeah, and George, all this comes as Dr. Theresa Tam, who was just on this program, releases her annual report. And one of the headlines, maybe the biggest headline, is how unequal this is hitting people, that people of color are impacted significantly more. What does that say about how the government has responded when you got certain communities that have been just absolutely devastated?
Well, the interesting thing that Dr. Tam was saying is that this existed even before the pandemic. So all the pandemic has done is brought all these inequities to light. And that is one of the interesting parts of her report. It's a long report. It doesn't really tell us anything that in the last months we haven't already heard. We know that most of the deaths are in long-term care homes. We know racialized Canadians, low-income Canadians, women, people who have mental health, opioid crisis is gotten worse. One of the crises or possible crisis that she didn't talk about is what is happening today with people who need surgery, for instance. All these cases that are postponed and that will keep on getting postponed at one point may catch up with us. And there may be so many people waiting for operations or for surgeries that won't be able to get them. That is then a crisis, another crisis in the crisis. So, I mean, you know, if Doug Ford wanted to inject a little bit of optimism today, he came after Dr. Tam, and I listened to him, and I kind of thought that was welcome, a little bit of levity. I know that there is no levity in this situation, but all he said was, look, I like to look at the glass half full rather than half empty. We know the glass is mostly half empty, but if somebody wants to express some hope, I say, maybe it's a little bit irresponsible, but it sounds good to the ear.
I don't know, Dr. Sharkawy, you think that's responsible of a premier to, I don't know, what's your thought on that? When you heard it, you're on the front lines, you're seeing it. When you heard those words, what was your reaction, Doc?
Well, I wasn't surprised. You know, that's why, you know, he's a politician and I'm doing what I'm supposed to be doing, which is caring after my patients. And, you know, I'm responsible for being as honest with them as I can. And you know, when I have a patient who's sick, I don't mislead them. I don't present them with an outlook that I think is unlikely to be met. I try and give them as much support as I can to prepare for something that could be not particularly promising. And I'm happy to be wrong when that is not the case and they somehow pull through. And, you know, I think it's a tougher job when you're in the political spotlight to try and play that role. But I think it's a different role that needs to be played now. This is a pandemic where I think the messaging is very critical. I think the attitude and the narrative that is adopted by people really hangs on these sorts of messages. And I think we have to be extremely careful about what we're saying, ensuring that it's something that's going to be taken up by people and acted upon responsibly. And I fear that when we're selling false hope, people start letting their guard down and they start making decisions that end up allowing this virus to spread more rampantly than it should.
Perhaps what the Premier was trying to do is to combat this fatigue that people are feeling, and people are starting to say, you know what, I don't want to follow the rules anymore. I'm too discouraged. This is not working. One epidemiologist said, what? It's going to last 1,000 days. So, you know, it is discouraging, and a few words of encouragement maybe helps people get through today and tomorrow. That's it. But obviously, he's not a doctor. He's a premier, and he's a politician, and he does what politicians do.
Goldie Hyder is about to join us, Ben.
Sorry.
Go ahead, Doc. No, respond to that.
You know, I hear this term of pandemic fatigue and caution fatigue a lot. The problem is that we've got to understand that there's no such thing as viral fatigue. You know, the virus doesn't care. The virus has no qualms with hitting people when they're fed up or they're frustrated, not being able to meet up with their friends or have dinner parties or play team sports. The virus will be there. And as long as there's no herd immunity and an effective vaccine to bring it down to a near negligible level, it's going to hit us. So we've got to get a way around that. We've got to find messaging and constructive ways to help people deal with this and cope with it. Pandemic fatigue needs to disappear. We can't keep enabling that.
Let me just quickly go to Goldie, to you, Ben. Goldie Hyder, who's the CEO of the Business Council, and he's standing by. He'll join us in a minute. He wrote a letter to the Prime Minister and the Finance Minister. One of the things he said is, Canadians have grown increasingly frustrated by confusing and contradictory public health advice, causing some to lose faith in the system's ability to protect them. This cannot be left unaddressed. It's what the doctor and Joyce were just talking about, this so-called COVID fatigue. Is there a responsibility there, the mixed messaging that has led to that? Is he right?
I mean, yeah, Goldie's not wrong. And I think the concern, I think what Joyce is saying and what the doctor is saying are correct. I mean, I think there is a delicate balancing act for people in business, for people in politics, for people in medicine, to sort of say, look, we have to have some perspective here. We're talking today about this milestone of 10,000 deaths, which is a horrific toll in Canada, Evan. But I did a little calculation, and if we had the same death rate as the United States, we would have had 28,000 deaths. They've had 227,000 with eight times the population of Canada. So I think things are not great here, but they could be much worse. They're worse in Western Europe. They're worse in the United States. And I think that that's important. And I understand what Goldie is saying about confusing messaging, but I also think that it's important to understand that the messages have been evolving. Remember, Dr. Tam, who you just spoke with, earlier on this pandemic was not saying we should wear masks. Now everyone says we should wear masks. And I don't fault her for her thinking evolving, because we're all learning a lot more about this virus as we go along. Businesses are struggling to cope. politicians are struggling with their messaging. So I think all of us have to sort of take a bit of a chill pill. We can't have COVID fatigue, but we can't help being human.
Yeah. Yeah, it's true. There's a difference between contradictory messages and evolving messages in a virus that we're learning about. Guys, I got to take a break. Dr. Sharkawy, I can't thank you enough. I always appreciate having you on the program, and you just do tireless work. Thank you so much.